The following video was created because of recent changes in the supply chain with Baxter due to a hurricane. Because of the hurricane, you will be receiving products from different countries. They will be Singapore, Thailand, China, and Ireland. Each of them are the same exact solutions that you're used to using, but a slightly different method of opening or utilizing them. Please enjoy the following videos to use as a reference point for receiving each of these products. This is our Singapore bag. This is an extraneal bag. So this is again where it's important. We have a little bit different of locations on here. So the S is strength. It's right here. Extraneal peritoneal dialysis solution with 7.5% icodextrin. Remember, icodextrin is 7.5%. The others are not. The E is the expiration date, which is manufactured and when it goes bad. So on here it says made in 2024, goes bad in 2026. So that's your expiration date on the bottom. A is the amount, it's 2,000 again, and L is leaks. There's no leaks anywhere. With the Singapore bag, the med port's in the same position as the United States, and the frangible at the top is in the same exact position. The top green frangible is the same. The one major difference that's really going to be difficult is that every single one of the pull rings is green in Singapore. There is no differentiation between yellow, green, and especially for the Premier patients, there is no purple ring. So you have to look at the SEAL acronym to make sure that you're using the right supplies. The next biggest difference is that there's two clamps built in already with Singapore. The blue clamp is the fill line clamp, and the white line is the drain line clamp. So you'll notice with these other countries, the white line tends to be the drain line, but what I'm recommending is that you use the red fill line where the blue clamp is, and you just simply slide these out of the way. The same thing with the white clamp, you can slide that down and just simply use the red clamp that you would use to drain it, just to limit your confusion. Before every dialysis treatment, you need to make sure that you have available mini cap, hand sanitizer, a mask, and of course, hand soap that you'll be using at your sink. Now, we're not going to bore you with watching us wash our hands for 30 seconds for the full time frame, but please just remember 30 seconds of hand washing is super critical because that is the best way to protect against peritonitis. Hand washing is the single best thing that you can do to make sure that you and your loved ones stay safe when performing home peritoneal dialysis. Also, do not forget, in each instance when you're hand washing, to please make sure to turn off the faucet with the paper towel, not your hands, for risk of getting them dirty again. When you're connecting with the Singapore, you're going to put your transfer set in the same place, but the difference is you have to slightly rotate your Singapore to fit inside of the cone. It will fit in there, but it takes a little bit more work because of the size. So that's completely okay. It will squeeze down in there, but it takes a little bit more effort, which is really great to keep it in there and hold it nice and tightly. So you're always going to want to hold on to the outside of the ring. You're going to pull it, drop it. Then with your opposite hand, you're going to twist it off. Now you have to be careful that you don't want to bump and hit your hand onto the transfer set. And you're going to still slowly attach it and turn it away from you. And then at that case, you can start to do your drain. You open up your patient line, open up the drain line, and then after you've done it, you do your flush, where you're going to close yourself up, close the patient line, open your fill line, open your drain line, and then flush always before you fill. Once you've done this, you're simply going to close your drain line, open back up your patient line set, and then you're going to fill up. When you're doing your disconnection, you're always going to hand sanitize first, as we always want to be safe. Then what you're going to do is discard your old items. You want to get anything out from before, your old mini cap. Then, of course, again, the hand sanitizer is super critical here. Once you've gotten this all set, you're going to prepare your mini cap. Remember, there's two ways to do it. One is just to keep it in the tray, but the preferred method is to place it in the only way that it fits into it, set in front of you. But again, we prefer to put it in the cone, but some people choose to do it this way, which is fine.